Hello and welcome to Money Control. In today's video, we are covering a potential health crisis, the Marburg virus, a deadly disease closely related to Ebola. It has resurfaced in Tanzania and it's raising alarm worldwide. The virus has already claimed multiple lives, and with no vaccine or specific treatment available, the situation is escalating. In this video, we will break down everything that you need to know about the Marburg virus, its symptoms, how it spreads, and the ongoing outbreak in Tanzania. Stay tuned and let's dive in. So what exactly is Marburg virus? It's a severe fever caused by a virus that is closely related to Ebola. It has a high mortality rate, often reaching up to 88% in some outbreaks. The virus causes extreme symptoms including the fever, headaches, and bleeding from various body parts, including the eyes, nose, and mouth. The disease progresses rapidly, and without proper care, it can be fatal. Now let's talk about the recent outbreak. Now Tanzania is currently facing a serious situation in its northeastern Kagera region, where 9 people have contracted the virus as per the reports, and tragically 8 of them have died. This has caught the attention of the World Health Organization, or WHO, which has expressed deep concerns about the spread of the disease and its high risk to healthcare workers.
Laboratory tests conducted at Kabaile Mobile Laboratory in Kagera and later confirmed in Dar es Salaam identified one patient as being infected with the Marburg virus. Fortunately, the remaining suspected patients tested negative with other illnesses. This confirmed case of Marburg virus marks the second outbreak of Marburg virus disease in our country.
The WHO has already mobilized a response team to tackle the outbreak. All the cases so far have been traced back to Kagera, and medical teams are advising extreme caution when treating patients. This is especially important because healthcare workers are highly vulnerable to contracting the virus. In fact, the neighboring countries have also issued warnings due to the proximity of the outbreak. Now, healthcare workers are on the front line, but the disease presents a unique challenge. The virus, which is spreading through direct contact with body fluids, including the blood, saliva, urine, and even breast milk. This makes healthcare settings incredibly risky without strict precautions, and it is why the virus is so dangerous. Now let's take a closer look at the symptoms of the virus. It starts with a sudden fever, headache, and muscle pain. As the virus progresses, it causes vomiting, diarrhea, and even the stomach pain. Eventually, the patients experience severe bleeding, often from the eyes, nose, and mouth, and the disease can lead to shock and death within a matter of days. So how did this disease originate? Let's understand that. So this virus first appeared in 1967 with outbreaks in Germany, Yugoslavia, and Africa. It was initially linked to laboratory work involving African green monkeys, which were imported from Uganda. Now, while the first cases were animal to human, the virus spreads through direct human-to-human contact after that. The virus has resurfaced several times over the years, with previous outbreaks in Uganda, Angola, and the Democratic Republic of Congo. In fact, the most recent outbreak in Rwanda has just been declared over. But now, Tanzania is facing a new challenge. And with a case fatality rate as high as 88%, the virus remains one of the deadliest diseases out there.
So we saw that at week 3, which brought a lot of hope that this is going to be contained quickly, and now this week we are seeing even better results than 50%. We're observing 92% decrease in infections.
We're dealing with one of the world's most dangerous viruses, and continued vigilance is essential. Enhanced surveillance, contact tracing, and infection prevention and control measures must continue at scale until the outbreak is declared over. WHO advises against restrictions on travel or trade because they are unnecessary and can harm Rwanda's economy.
Currently, there is no vaccine or specific treatment for Marburg virus. This means that the priority right now is containment and ensuring that healthcare workers have the proper protective measures in place. The WHO continues to monitor the situation closely, and countries around the world are being urged to take the precautions. In Tanzania, local authorities are working hard to control the spread, but the situation remains urgent, as we have seen with previous outbreaks. The virus spreads quickly in regions and dense populations, and the lack of cure makes it all more difficult to manage. So what can you do for all this? So as we all know that this virus is a dangerous virus, and the recent outbreak in Tanzania is a reminder of how quickly it can spread. With no vaccine or treatment available, the focus must be on early detection, strict safety protocols, and public awareness. It's crucial to stay informed and follow any travel advisories or health guidelines issued by the WHO and local authorities.